Sorry. Hello, welcome everybody. We have a couple people joining us online and in person. Good. All right. So welcome to our COVID-19 Safety for the Whole Family event. My name is Lena. I work here at the library. I want to thank everyone for coming out to this program, including all of our panelists today, who Angela, the moderator, Angela Jones, will introduce here in a second. Before we get started, just a couple of reminders. For those of you here in person, please keep in mind that masks are required at all times in the building, over the nose and the mouth. For those of you joining us in person, please make sure to turn off and silence all cell phones and portable devices. And those of you joining us on Zoom, please keep yourselves muted until we ask for questions, as to minimize the background noise. Restrooms and water fountains are outside this door, down to the left. All the way past the desk, you'll see them. In case of emergency, please also follow that route around to the emergency exits, which are lighted. If you have any questions for our panelists, please wait until we ask for them, when I will ask you to unmute, or if you're here in person, I will hand you the microphone, and then we'll be able to see you. We are recording this on Zoom, for those of you on Zoom, so if you don't want to be seen or make an appearance visually, please keep off your camera. And then I also want to let everybody know, for the grown-ups, I want to let you know that our latest kids book chat is about books by Indigenous peoples. It was streamed yesterday on Facebook, but it lives there on the Facebook page. So if you have a chance and you want to hear about some great stories to share with your littles, check out our Facebook page for that recording. And with that, I'll hand it over to Angela.
Thank you, Lena. So, as Lena said, I'm Angela Jones. I'm the library's Youth and Family Program Coordinator, which basically means I do all of the fun stuff, all of the things that you see in terms of events for families with children under the age of 11. I work with our library to put those things together. We also, in the past 2 years, have started doing events that are specifically geared toward parents and caregivers of littles. And this is one of the events that we're having today. It's actually the first one that we're doing since the library reopened. So we're so happy to have our panelists here for the very first parent-caregiver event that we're having at this point in the pandemic. So I will say, as a public library, one of our primary functions is to increase access to accurate information for our community. Since I work with families in our library, whenever we have informational events, like the one that we're having tonight, I always try to make sure that the information is really easy and quick, not something that you'll have to spend a lot of time looking into later. We are very fortunate to have basically a rock star panel here, as you'll see when I go through the bios. Something that we do try to do is make sure that we meet people where they're at in terms of how they want to access information. You know, there's a lot of different sources that people like to access. So we have some medical professionals on our panel, some people that are not medical professionals, people that are part of faith communities. If you're part of a faith community and you don't have someone here tonight who's a part of your faith, you just feel free to reach out to us and we can connect you with, there's so many people of faith in our community, in so many churches that the library knows about. We'd be happy to connect you if that's something you're interested in. So let me just start with our fabulous panelist bios. And I'm actually going to start with Jennifer Davis, who is an RN, registered nurse, currently serves as the public health nurse at the Skokie Health Department. Jennifer, can you give a little wave so we wave? She served with Skokie Health and Human Services for over 1 year, joining the team in the midst of the pandemic. Awesome. She's a liaison for all public and private schools within Skokie, including daycares, an assistant providing direction to long-term care facilities. She also coordinates the volunteers for the Skokie COVID-19 vaccination clinics. Next up, we have Rabbi Ari Hart. Rabbi Hart grew up in Evanston and went to school in Skokie and ETHS before beginning his rabbinic career in New York. It's not from New York. That happened, Harlem. Yeah. Oh, okay. Okay. He previously served as the associate rabbi at the Hebrew Institute of Riverdale, where he focused on community outreach and creating a welcoming environment for all people within the Orthodox synagogue. His previous rabbinic work took him everywhere from Yale University to Rikers Island in New York to the shores of Lesbos, Greece, responding to the Syrian refugee crisis. An activist rabbi, Rabbi Hart has led multiple efforts to increase awareness of justice issues in the Orthodox community, including advocating for immigrant workers in the kosher industry and fighting for victims of sexual abuse. Next up, we have Dr. Omar Khan. Dr. Omar Khan is a medical doctor who has had a number of years of experience in clinical research, which included drug development and clinical trials. His research was primarily in pain management with focus on the opioid epidemic, where his research, work, and publications contributed to changing medical policy. He currently works as Director of Health and Wellness at the Douglas Center, a nonprofit organization that provides services for adults, intellectual, and developmental disabilities. Dr. Khan is also the co-chair of MCC, the Muslim Community Center Health and Wellness Committee, where he has implemented community health education, resource, and activities. One of the committee's recent successes has been the COVID vaccination clinics, where they have vaccinated over 1,600 community members. Next up, we have Reese Burkitzer. Reese is a biological sciences PhD student at Northwestern University. He has worked in the laboratory of Dr. Jalene Jarity since May 2020, performing computational epidemiology. I'll just go over it. Modeling the spread of COVID-19 in the state of Illinois, supporting the governor's office in Illinois Department of Public Health. He also serves as a public service intern at the Chicago Department of Public Health. And last but certainly not least, we have Dr. Sharon Robinson. Dr. Robinson received her undergraduate degree in psychology from Duke University, followed by her medical degree at Indiana University School of Medicine. She completed her pediatric residency at Lurie Children's Hospital, where she also served as chief resident. Dr. Robinson joined North Shore University Health System, where she has practiced as a general pediatrician for over 19 years. During her tenure, she's moved into several administrative roles. Most recently, she has been appointed Assistant Dean of Diversity and Inclusion at North Shore. Dr. Robinson is an active member for community, serving on several boards, including Faculty Practice Association at North Shore, Evanston Community Foundation, and Evanston Dance. Didn't I tell you we had a rock star? I don't know that we'll be able to assemble something, a group that has this wide, just the breadth of experience in the room and the different points that our panelists here are accessing our community. So thank you all again for being here. And I think, I want to make sure that we spend a good amount of time making sure that everyone gets everything that they are hoping they'll get out of today's event. So I think what I'd like to start with is just asking some of our folks online and also in the room, just to let me know if you have specific questions that you were hoping to be answered tonight, or if there are specific things you were just hoping to get. Should we start in the room?
Sure.
Okay.
I'd just like to address what's the risk that we're going to be facing with the upcoming holiday, with, you know, children maybe not vaxxed, half vaxxed, fully vaxxed, and, you know, the wide variety of adults who may or may not be. What's the risk across the spectrum, do you think?
Okay, I'm gonna hold all of the questions. Okay, so what's the risk that we're facing? Awesome. Well, do you want to go to the online?
Do we have anyone online that would like to share with us some questions that they're hoping will be answered tonight? At this point, you can raise your hand, you can put it in the chat. If not, we will move forward.
Okay, we're gonna do.
Yeah, I'm not seeing any.
Okay, we'll get started then.
Oh, here we go. Sorry, what?
There's a delay.
How do we know there are no long-term effects of the vaccines?
Good question. Just a point of clarification. Are you asking about long-term
I think long-term adverse.
side effects? Adverse, okay.
Yeah.
Okay, great. Anyone else? You don't want to go in there. So one question that I had that I'm hoping we'll get to tonight is for people who are parents of infants, children under the age of 1, when do they expect to get access to the vaccine? All right, so what I'll do is I'll periodically check in with Lena, and I think we have another
Yep.
one more question. Okay.
When will the third vaccination be available for healthy people?
Okay. Awesome.
So I'm guessing that's the booster beyond what
Correct.
is currently offered for the various criteria that are in place.
Another great question. I'll periodically check in with Lena to see if additional questions come up, and we'll also reserve some space at the end for questions. So if stuff comes up as we're going through, please feel free to just type it in the chat box or raise your hands and we'll get to it. Okay. So, let's see. I have some weird questions that I'm going to start with, and we're going to sprinkle some of the questions that we've gotten from our audience throughout. So, I'm wondering, just as a question for the group, if you can talk to us about how effective masks and vaccines are preventing COVID-19 transmission. At this point in the pandemic, what are you seeing from your vantage point?
So masks are essential for everybody, not only the person who could be contagious, but those who are around them. Having a mask is more of a protection. If you cough, if you sneeze, as you're talking, particles are coming out of your mouth and out of your nose. And that actually goes for pretty far distance. You know, the space, social distancing is 6 feet, and you can't actually be beyond the 6 feet. But this helps to protect those particles, keep them with your body, with yourself, and no longer exposing those around you. There are actually quite a few animations online that will show the particles being sprayed. And just as I went to go eat at Starkey's with my family, and they were cleaning the table with the spray, and the table was 20 feet away, but I could still feel the spray come and kind of sprinkle me. So I was like, wow, that's how far it can carry in the wind, as people are breathing, as people are laughing, as people are speaking, especially if they're engaging in exercise or just sitting next to each other in discussion.
If I can stand on to that, I think that was a great example as far as the stargazing goes, because one of the things that we used as an example at the Douglas Center, which we talked about briefly, this is a program where we provide services for adults with intellectual and or developmental disabilities or special needs. So when trying to provide a simple example, something that is digestible and consumable, I took a spray bottle and just sprayed it in the air, and you can actually see, where it goes. You won't necessarily be able to see exactly how far it goes, but you'll see another droplet spray out. And then you just hold the mask in front of it and then spray again. It gives you just a very simple, visual of how it can be that barrier. The other thing, as far as how effective the masks and vaccines have been, I think being here is an example of, how helpful it has been since the recommendations have been done. The other thing is, again, I work with MCC, which is the Muslim Community Center. We had to close our doors there as well. The way prayers are done is they're in rows and people stand shoulder to shoulder. You stand and prostrate and things along those lines. Obviously during COVID that wasn't possible. We had to close our doors. And we're back to being able to do that again. We're wearing masks. We put tape out on the ground and maintain the distancing. But it's been important. Unfortunately, we do know of various community members who we've lost along the way, some very important leaders within our community, actually, from, again, the Faithbased group. The other thing that we've been doing, which has been providing us a bit more insight into how effective these vaccines and masking has been, is at work again at Douglas Center. About 98% of our participants are vaccinated right now. But yet we still, and we have to wear masks while we're there, yet we still are doing tests weekly. So that has also been able to show over time, how effective it may have been. There are times, again, when you may have some of those breakthrough cases, and we're talking about the boosters now as well for a number of those individuals. So, again, just some examples of what we've actually been able to see in the real life as to how effective some of these things may be.
I'm not a scientist, but I serve a community, and like your community, prayer and gathering together for prayer is so important. And we've actually been gathering together following the Scope Department and Illinois and CDC guidelines since last July, not this July, but last July, so almost a year and a half now. And we pray twice a day, gather. So every single day, twice a day, at least 12 and up to 100 people have gathered together in our social hall with distance, with the windows open, with masks. We've not had a single case of transmission over those 18 months, how many days it is times two, hundreds of gatherings. We've even known cases people have come and the following day they wake up and they're symptomatic, so it turns out they were probably positive when they were in the room, but because they were masked, there's been no transmission. So it's anecdotal, it's not science, there's no paper published on it, but I would say and my colleagues who are rabbis in similar communities who have followed the protocols also had no cases of transmission. So the masks are effective, and they're an effective way to gather together, which I think is so very important to be together for all the health reasons that we know about socialization and those things, and masks have been a way to do it safely.
Yeah, and speaking about science, it tells you the same exact thing. So when you run a statistical analysis, looking, for instance, in the state of Illinois, and basically controlling such that you're looking at communities that are similar demographically, similar income-wise, and basically just controlling for it as much as possible. Vaccines make the difference in which are currently experiencing a surge, in which are at historically low levels of incident cases. So when you look at stuff like from a statistical perspective, it's also borne out in that. So you hear all these stories and everything about how well-controlled things are with the advent of vaccines and with masking as the recently newer recommendation for vaccinated people. And it bears out from multiple perspectives, including the perspective of epidemiology.
Does anyone want to say anything more about vaccination?
Yes, I'm happy to take that one as a pediatrician who lives and breathes vaccines. So never has there been a more exciting time in my career as a pediatrician. It is in my life as a parent of children. My children are teenagers, so they were vaccinated a little while ago, but, as an aunt or a community member of younger children in particular, to see them finally be eligible for the vaccine. And thank you for bringing up, weaving in the importance of the vaccination. So, since we've been since we've been living with COVID and trying to figure out how to navigate, one thing that we have really found is critical is a layered approach of protection. So using every tool in our toolbox and layering those in order to provide optimal protection. I think that's what we're all talking about. So masking has been great. Masking was the key to getting back to some things that were so important, like our faith-based organizations, getting our kids back into in-person learning, which was critical for their emotional and social health. And now that we have the vaccine as well, you layer the vaccine with the masking, it just provides this phenomenal amount of protection against COVID. And I do want to say that the vaccines are highly, highly effective against severe disease, hospitalization, or death when it comes to COVID. So I know there's a lot out there about breakthrough infections. They do happen, absolutely. This is why booster vaccines or third dose vaccines are becoming something that I've already gotten mine as someone who is high risk because of my job. This is something that I do believe, to answer that question, will be actually Pfizer and Moderna have asked the FDA to approve boosters for everyone. I anticipate that will be happening in the upcoming weeks. But it is so critical for us to understand how powerful these vaccines are. So although people can get breakthrough infections, that is true. The vaccines are still doing what they were designed to do, and that is to protect us and keep us from being hospitalized and protect us from death.
Yeah, and also just, if we can also add on as far as the breakthrough cases and the severity of the cases. Are you able to touch on that real quick as well in your own experience? Because again, when we talk about the individuals that we're testing weekly, some of which may have had the breakthrough cases, a number of them, they've been asymptomatic, and so, yeah, if you want to.
Yes, absolutely, that's a great question. So those who have been vaccinated and have had the virus, many don't even know that they've had it. So a lot of times it's from surveillance testing, and so they're asymptomatic. That's the only way we even know. And then the overwhelming majority do have a very mild case, just sort of like a common cold type symptom. So I know we've heard about, for example, Colin Powell and his unfortunate death from complications of COVID despite being vaccinated. He was immunocompromised. He was suffering from a rare form of cancer. And that is another reason why it's so critical for everyone who can to be vaccinated, so that we can protect those that are vulnerable and can't mount a response to the vaccine, or our younger children under age 5 who are not yet eligible.
I think that also just speaks to, again, when you're talking about the asymptomatic or mild symptoms, that also speaks to how the vaccines have been effective. Right, so.
And it shows in the statistics. So for Scopy specifically, we have had a multitude of breakthrough cases where people are vaccinated, not a lot, but those who are hospitalized were those who are not vaccinated. And those who end up in the ICU and need assistance breathing, and intubated, those were all people who were not vaccinated or only had one dose and never went back for their second dose. We did have 2 individuals out of the group who did pass away who were fully vaccinated. Both individuals had multiple underlying conditions, cancer, end-stage renal disease, so many other serious conditions that contributed to their death. Besides that, those who are vaccinated, again, may not even know due to they have no symptoms, or maybe a runny nose, lots of people have a runny nose and contribute it to the common cold or allergies, and they end up being positive. But vaccination has absolutely helps to keep people out of the hospital and healthy.
No, sorry, do you want me to go?
Yeah.
I was also gonna say, like, we're talking about the effect of symptoms and everything, which probably also mentioned that also indicates that you are less infectious if you do become infected and you are vaccinated. Because the way that the virus works is it'll get into your body and it'll replicate many, many times. So basically, the more that it replicates in your respiratory tract, the more particles that you're breathing out, and the more likely you are to infect somebody else. So something like vaccines, which prevent you from getting infected, but also really reduce the severity of that infection and that quote-unquote viral load, will also protect the people around you, even in the case of a breakthrough infection.
My heart mentioned the importance of coming together and how things like vaccines and masks have allowed us to come together safely. I'm wondering if we can touch on the question about risk. What are the risks that we're facing in the upcoming holiday season? Can families get together? Can extended families get together? Do you have any recommendations for traveling out of town? Someone's asking if you're staying in your family's home, if you're going out of town, what are the recommendations that you have? Especially, I know something that's come up at our desk is if you're going to visit family in a community that might not have the vaccination rate that we have, in this area. What are your thoughts on that?
I think the first thing is you have to know thyself and understand what your risk tolerance is. I think that will be very personal for folks. So, what I'm going to share are my thoughts and, obviously based on what I know from yeah, is this on?
I was gonna say.
Yeah, I don't think it is.
I'm gonna be able to get the audio up too well.
Yeah. No, that's okay. I told you I'm sensitive. Because I know I have a hard time.
Oh, there you
Is that
go.
better?
Yeah.
Okay. So I was saying, everyone has a different risk tolerance. And I think that's important for you to have an honest conversation with your family members ahead of the holidays about how you're feeling about things and where you are. I can tell you from a science perspective, and so this is the way that I'm approaching it myself and how I'm advising my patients and families, even those with younger children who aren't eligible to be vaccinated. My feeling is if everyone in your extended family or your gathering is vaccinated who can be, then I think that, and obviously they don't have symptoms, then I do think it is safe to gather this year for the holiday in a setting, like a family traveling out of town and staying together in a home. As long as everyone who can be is vaccinated, then I think that is reasonable. But again, that has to be, you have to make sure that's something that you're comfortable with. I think because of the vaccine and only because of the vaccine, we're in a lot better position than we were last holiday season, where, I don't know about all of you, but it was just myself, my husband, and my 2 daughters hunkered down for the entire holidays and didn't see anyone else. We do plan to spend the holidays. My parents are coming in town we celebrate Christmas, so they'll be coming in town for that this year. So I do feel more optimistic. I feel safer because of the vaccine. And that's how I've been advising my families. I don't know if others have, if the 2 of you have other thoughts or additional thoughts on that.
Oh, yeah. No, I absolutely agree. If everyone who is eligible for vaccination is fully vaccinated, and that means 14 days after their second dose. So please don't go get your second dose the day before your holiday, because that does not count. So it must be 14 days after dose 2 to be fully vaccinated. If you are eligible for your 3rd booster dose, please go ahead and get that as soon as possible. Because the more vaccinated that you are with your family and all people. Also take into consideration, what is your risk beforehand? Have you been attending parties or have you put yourself in maybe considered high-risk situations where you're exposed to more people, you might want to make that decision for yourself to not then expose others. So maybe decreasing your activities prior to the holidays. And then just in terms of traveling, because everybody needs to get to where they're going, so if you're going on the airplane, please mask up and continue to stay masked up. I recently went to Seattle, and in doing so, I made sure to eat before I got to the airport, and I didn't take off my mask the entire time at the airport or on the plane, or once I got outside, then I was able to unmask. So it does get hot, it does absolutely get a little irritating, but it's much better than exposing yourself to other people.
Well, I actually just, not necessarily, add on to what you all had said, because I think you guys provide great guidance, but just thinking back to how things were, before, because you were talking about last year, and, it made me think about my own family. We've got a number of family members that also work in healthcare, friends and colleagues, things like that. And, I'm thinking about my wife right now as well. Before we got married about 7 months ago, a couple days ago. She might be listening in, so hello there. But, before we got married, she would tell me about how, because she also works in the hospital. She was in her last year of residency, but she was living with her parents at that time. And again, at a time when this was all new to many of us, we didn't fully have a grasp on what was going on. And she would tell me how, she would come home, wouldn't really even see her parents, go to the room, shower, change, and really just stay in the room. Not be able to hug her parents, not be able to hold them, not be able to sit in the same room as them. This is, very much so many people's stories, So it's a blessing that, in many ways that we have these protective measures. I know I'm going to be spending time with my family, in December, January, some close cousins as well, so I'm really excited about that. But again, unfortunately, we have these tools in place to be able to do that. I'm actually hoping to get my booster, I think, at the end of this week. But, it's beyond the, vaccines and masks and things like that. These are all kind of tools that we can utilize to hopefully get back to some sort of normalcy. But just thinking back to what it is that we were going through. I think sometimes we forget what it was like. I know the timeline has just been really thrown off for me. I have a difficult time remembering what happened in what year over the last 2 years. But just thinking back to, again, how fearful many people were, how many people have actually lost their lives. We know people personally who have had to get lung transplants as a result, and even then, 6 to 8 months later, losing their life. Other individuals, again, having to get transplants and still dealing with the effects of that. So, of course, we don't want to see this happen to anyone, regardless of whether they're close to us or not. But I think we all want to get back to some sort of normalcy, right? And so I'm hoping, again, as things move forward, we are still cautious within this holiday season, because there may be a spike or surge that we may see, because a number of people will have that time off. But yeah, definitely enjoy that time with your close ones if you can, but please do continue to take those safety measures if you haven't already, again, whether it be vaccinating and masking, things like that. But I am hoping to spend some time with family again and being able to do it in a safe manner. Yeah.
I was going to ask the rest of you, what role do you think testing should play in your holiday plan? So testing, again, in comparison to last year, is way more widely available. You can pick up the antigen tests at Walgreens, which are generally really good now. Still not as good as a PCR test, but very convenient. You get the result very quickly. So do you think people should test at all before they go anywhere or meet up with people?
I think a number of places, especially outside of the states, that people are going to be traveling, some of those are all requirements, right? I know we had gone to Costa Rica over the summer, and we had to get tested before going, before coming back. So some of those things may be in place. I know a number of work sites may already implement that as well. again, the Douglas Center, we do that weekly for as long as we can for the time being, or as long as we're still seeing that this is the situation. So yeah, a number of places may continue to do that. I would say that it may be a good idea too, especially after coming back, but again, there's that period, right, of, 3 to 5 days or so, after the fact, after the potential exposure, that you may then test positive, you are positive, so.
I don't believe that testing is actually necessary for vaccinated individuals in areas such as this, because our positivity rate is pretty low, thank goodness. However, I agree, if you're coming back from a higher risk area, it might not be a bad idea, especially, if you were traveling by plane, which, by the way, the airplane itself is fine. That's not the issue, because they have that very well contained and controlled. It's the airport is really where the risk comes in that piece. So I would say I don't think there's any downside, because it is more readily available. But if you're getting together with your, parents who live, in Evanston and you live in Skokie, I don't think it's necessary if all of you are vaccinated to get tested before you get together.
If you choose to get tested prior to the holiday, it's best to do it, within 72 hours of the gathering. And then afterwards, if you feel like, that was maybe a larger gathering, then I would apply for, realize it was going to be, if you want to get tested after you possibly had one, wait till day 5, because that's when the most accurate results are.
Can we take a moment and just talk a little bit about risk? I want to ask specifically about vaccinations. What, if any, risks or downsides would you say you're seeing from your vantage point? And there was a question about, and this is a question that we've gotten, I know, at the library quite a bit. How do we know about long-term adverse side effects? How do we know? One of the ways this comes is, well, Johnson told us baby powder was okay, later find out it's not. How do we know that there's not going to be a similar situation with the vaccine, especially as parents are getting their children vaccinated or thinking about that? Can you talk a little bit about that? What we're seeing, what we know?
To start with what we've seen, we have seen no adverse side effects, meaning no dangerous or life-threatening side effects from the vaccines. I'm talking about for children, for Pfizer. The Pfizer vaccine is the vaccine that is approved for 5-year-olds and up. Moderna, just to make sure we're all speaking the same language. The Moderna vaccine is for 18 and up. The Johnson & Johnson vaccine is also for 18 and up. So speaking about Pfizer in particular and the trials that were done on children, there were about 2,000 children who were studied in the 5 to 11-year-old, and they're continuing to monitor those children that were vaccinated, and to date, they have had no adverse effects at all. The side effects from the vaccine are very similar to what we see in adults. It's sore arm, fever and chills in about 10%, goes away within 24 to 48 hours. You can treat with Tylenol or Motrin. So I think to answer the question about the long-term effects, obviously we don't know the long-term effects because we don't have the long-term data. However, these vaccines were first given, it will be 2 years before we know it, that the first groups of individuals, and it was Pfizer that was first, were getting this vaccine. So that's a lot of data. Never have we seen a vaccine being rolled out under such scrutiny and widely observed and followed and given to so many people. I mean, think about the millions and millions of individuals, I believe up to 70% of adults now in the United States are fully vaccinated. And then you look at world data too, and we've heard nothing about really any adverse effects of these vaccines. So we have to really keep that in mind. The other thing that I remind folks when they get nervous about the vaccines, which is totally understandable, is that immunizations and vaccines are the most well-studied thing that we put in our bodies. It is, I guarantee you, there has been more thought and detail and studying about this vaccine than any food you consume, any over-the-counter medication you take, any herbal supplement that you use. So I want to really keep that top of mind, that these are constantly monitored, and their CDC and the FDA continue to monitor these vaccines very, very closely to make sure that they're safe and effective.
And this is not a new concept. Immunizations have been around for decades. And so it's what keeps us safe. It's how we eradicated polio, right? And how we've eradicated many other communicable diseases. So the concept and the science and the technology and the research development behind immunizations in general is longstanding. And also the SARS virus has been studied for many years, actually. It's not just COVID, but there's been research, SARS, MERS, yeah, there's been many years of research regarding the family of viruses that this falls under. So none of this is actually new. It may be new to the general public for those who don't follow research or don't follow healthcare, emerging new technologies and information. But all of this information, it has been around and has been studied very much in depth, and like Sharon was saying, for many years, many decades.
I think also, I don't have kids myself quite yet, but I know these are very valid questions. Parents, I think many of you who may be parents can probably speak to it, but after having a child, from what I hear, number one goal in life becomes to protect those children, right? And do what you can to protect those children, even if that means, putting your own life on the line for it. So these are valid questions, and I understand, people shouldn't be shamed for, not understanding. A lot of the decisions that are also made, in healthcare and medicine, as parents, you are very much kind of comparing, right, benefits versus risk, and figuring out do the benefits outweigh the risks, right? And what you're seeing also from data, again, like our pediatrician on the panel just spoke about, if we're talking about kids in particular, their dosage also isn't the adult dosage. Right, it's almost about maybe one third of the adult dosage. So, from what we understand as far as the side effects, some of the most severe or the most common that we've seen have been the redness, the swelling, and also keeping in mind, I understand when thinking about children, there is that thought that it's not as severe for them, or they may not deal with it as seriously as many of the adults may deal with it, or they may not have a lot of other complications and chronic illnesses that many of those who have passed deal with. But at the same time, I believe COVID is in the top 10 causes of death, right, for children, which is a serious thing to think about. The other thing that, when I think about the special needs population, depending on the study that you look at, individuals with intellectual and developmental disabilities are anywhere from 3 to 6 times, I believe, more likely to get COVID, to then die from COVID. And some of those reasons may be sensory issues, right? Some people have sensory issues where they can't wear a face mask, they can't put anything on their face. Adhering to hygiene guidelines. They may have difficulty following some of the rules and guidelines with keeping clean, washing their hands frequently, things along those lines. Wearing their mask properly then. For those who do, these are some of the difficulties and challenges that they may face. And then they also have some of those chronic illnesses and comorbidities that complicate it even more and put them at higher risk. there are some of those commonalities with children as well, right? How many of them may actually be wearing their mask properly when they should, or how many of them are following those hygiene guidelines? It's probably difficult already to get them to brush, right, once a day, or shower, however often you want them to. But, there's that, and there's also the aspect that they are potential carriers as well, right? And can then carry it to the grandparents, if you are going on a trip to see them this upcoming holiday. So
Teachers too.
teachers,
Yeah,
yeah,
protecting
absolutely.
everybody.
Yeah. Absolutely. So, just some of those thoughts to put out there as well.
Check in with Lena. Do we have any additional questions?
Not at this time, no.
Okay, I want to pause just in case anyone does have any questions. Please raise your hand online or email me any questions.
While you're doing that, can I ask a quick question also to our rabbi in the panel? Just as far as your own experience with, the faith-based community, how it was maybe in the beginning of COVID, during COVID, maybe some of the challenges that you all faced. I know at this point you're saying things have gotten a lot better with being able to wear the mask and things along those lines, and also any potential questions from a faith-based perspective when it came to vaccines and things like that, because I know our community definitely had those questions. Muslims had a lot of questions regarding, is this something that's permissible for Muslims? Are there, animal byproducts, things like that may be used when creating this, or, the fetal aspect. So just from a faith-based perspective, because I'd be curious to know some of that, and I don't know, maybe that'll be helpful for some people listening in as well.
Thank you. We dodged a bullet. March 2020, we were celebrating a holiday in Rich. I had spoken with you. We were in touch with the Skokie Health Department. We were celebrating March 13th. So, right before we shut down. And the holiday's called Purim, and it's a day where you get everyone, you gather as many people as possible into one room, and you sing and eat a ton of food, and then everyone goes from that to everyone's house, and you go from house to house. It's literally the worst possible holiday. Thank God we didn't have active cases in the community at that time, because we had a lot of people who died, and that's what happened in New York. In New York City, the Orthodox Jewish community specifically got really devastated because of that holiday. And it's very tragic to think that a holiday killed people. They didn't know. At that point, it wasn't like you were breaking rules or anything. Nobody knew. We were following rules. We hired servers and we made them wear gloves. And we told people to wash their hands a lot. So we're getting very safe. And it was, looking back, we were dodged a bullet. But, in Skokie in general, the numbers of vaccination are very, very high. I think we're a community that is very connected to our traditions and our faiths, but also is embraces science, and that's certainly what I'll call the non-Orthodox community of Skokie is a very scientific, we believe in the value of science from a religious perspective also. In other communities it's been more complicated, there's been a lot of problems and a lot of debate, and people have died as a result. That's a tragic thing. People were actually in my synagogue, we assembled this, people were so desperate to get the vaccine. And so we were and there was a lot of old people who didn't know, at first it was so crazy, you had to get on these lists and online, all this crazy stuff. So we had tech savvy teens helping seniors, and we created this whole campaign. And so, again, I'm very grateful to our community for really believing the science and following the guidelines. And that's enabled us to be able to gather together so much with no consistent transmission. So we've done okay. We got lucky, I think. And we're going to keep holding the course. And adult vaccination was, I think, 100%, almost universal. I'm curious to see, I'm curious about children. I'll share just honestly as a model. I had my own hesitancies about vaccinating my kid. And I was like, well, he's not really at risk. And the vaccine isn't really a risk either, but maybe it's a little bit of risk. I don't know. Why don't I do it? He's going to be fine. And the things that were shared here, it's not just for him, it's for everyone around. And even though the risks of COVID they are very, very small. Children are, correct, but children without pre-existing conditions, I think, are statistically safe. from hospitalization and serious consequences, but you never know, and they still do get sick, and, it's good to protect them. So we have our appointment for my son on Monday, so we're very excited. So yeah, but I'm curious to see, like, in the coming weeks and months with the schools, I think that'll be interesting to watch how that goes.
Without getting, oh, I'm sorry, I was gonna say, without getting too personal, if you're comfortable sharing, what was it that helped you decide to make that appointment? Because I think that would be helpful, again, for other people.
My wife.
Okay. That's the answer right there, yeah, okay.
I think that, thank you for sharing that. I think that's important for people to hear, and thank you for for trusting and for getting your children vaccinated. And what you actually, I think about this a lot because I get that question a lot. I think it's a very valid question, and this isn't, why should I, take a chance, on this vaccine for my child when the odds are, and you were right, for some, reason, this respiratory virus does not seem to affect children the same way it does older folks. So it is legitimate. The way that I've been looking at it and really framing it, I think about this month being like the month of gratitude. And I think that's, no matter what you believe or what your faith is, I think we can all, we could all use some gratitude. So I think everybody should take November to celebrate that and think about that. And part of that is, not only being grateful for our own health, but being grateful for what we can do to keep others safe. And what a great lesson you are teaching your children, for them to be so brave to get this vaccine, and not really to protect themselves, that's a small part of it, but it's really to protect their community, it's to protect their grandparents, it's to protect their classmates' grandparents. And that I think is such a beautiful gift and a beautiful lesson that we can teach our children through this, is that sometimes we don't do things because it's good for us. Sometimes we do things because it's good for everyone, or it's good for others. So I've been thinking about that as a way to really frame it and a way to make you feel empowered and proud of what you're doing as parents when you choose to teach your children that valuable lesson. So thank you.
I think from, when speaking about faith again, I think that's very much the model, right? Is you think of the community, and in Islam we have a term for it, ummah, just means, the community, and it is very much about thinking about others and doing for others. And, yesterday we had, there was this hearing in Chicago, and Representative Foster actually had asked this question about, I've heard of a number of individuals from faith-based communities just saying, we believe strongly in our faith and we leave it up to God. And this was something that I've heard before as well, but and maybe you can add in a little bit to this as well, but the way we've understood it when speaking to other religious leaders, when speaking to other healthcare professionals, tying in some of those conversations, we also understand that we are meant to take care of ourselves, take care of those around us, that we are supposed to gather knowledge, gain knowledge, are supposed to, utilize the gift of thought and learning. And I gave this example the other day as well, is that when Islam itself was revealed to the Prophet Muhammad, peace be upon him, the first words that were told to him were read, from, we say, the angel Gabriel. He said it 3 times, read, Iqra, read, and he was illiterate, so learning and gaining that knowledge and utilizing the intellect that you have and, doing the research and conducting the clinical trials and then taking action after that, right? It's very important to take, because you can pray and hopefully the things that you wish for will happen, but it's also important for us to take that action first and then also pray as well, So yeah, just a thought again from a faith-based perspective.
I mean,
Yeah.
So, before we end, I just want to close us out and see, from our panelists, are there any, if there's one thing that people watching this tonight or in the room could take with them, what would that be? Or is there a resource you want to share? So something people can take with them, or a resource, a community-based resource, and help them if they're thinking about COVID safety?
Mainly just ask questions. If you're unsure of anything, that's why we're all here, is to help everyone figure out what is the actual information, what's true and valid information, and if you don't understand something, everyone is happy to explain it. So we want to educate as much as possible. We're willing to have discussions. I'm sure that's true for everybody up here. We love these discussions. We love sharing the information that we have. So if there's anything that you're not sure about or you have hesitations about, please ask. We're always there.
I think also, of course, CDC is something that we always say as far as a resource. But also, similar to what you said, just ask the healthcare professionals that, your primary care providers. Of course, from faith-based perspective, get the spiritual guidance that you need as well. I also just wanted to quickly add in, because this is something that we were talking about before we started, just, we're talking about some of the downsides of masks and things like that before we, end. I think we all want to get back to some form of normalcy. I know we don't think too much about some of those difficulties and downsides when we do wear face masks. We were talking about before this about there are individuals who may be hard of hearing, are not able to understand what you're saying as a result of that, right? And a number of other challenges that may come with it. We're talking about the sensory issues for individuals with special needs. So, hopefully we can all take the action that's required and, again, get back to some form of normalcy.
I think seeing people's smiles and reading everybody's expression is huge, and I'm just saying that.
A great resource is a website, HealthyChildrenorg. It is sponsored by the American Academy of Pediatrics, and it has a very science-based but easy to digest information on a variety of topics for parents, especially a ton of useful information about COVID and about the vaccine. So I would highly recommend that website. And you took the words right out of my mouth. My kind of takeaway is that vaccination is our ticket to normalcy. So everybody get yours today.
Yeah, a lot of stuff has been touched on, and I hope people walk away with many lessons, including the primary one about vaccination. There are lots of great dashboards from the Cook County Department of Public Health, from the Illinois Department of Public Health, to keep track of where things are at in our community and outside our community in terms of disease prevalence. I will also say, the number one reason why people don't get vaccinated is vaccine misinformation. And you can combat that by educating yourself and educating others. So when you come across a good resource, like this wonderful resource that the folks at the Skokie Public Library have put together for you guys, share it with other people, because you don't know who could be out there who doesn't know where to turn. And that could be just the right information that they need. And number two reason is the side effects in the acute phase. So you could be sore, you could have fatigue, you could be tired, and understand that will sometimes happen for children as well. So a tip that I've heard is make sure that if you have to take care of your kid, that you are available to the day after they're vaccinated. So if you want to get them vaccinated on like a Friday, if you have the weekend off, the number two reason is people are scared to miss work. So if that's a concern for you, you can time out your vaccine or your child's vaccine so that it is most convenient for you.
I feel really humbled to have been on this conversation with so many smart and qualified people. I'll just say the last coming up on 2 years have been really hard. And they've been hard from physical health challenges, people have been sick, people have died. And they've been hard mentally and spiritually and emotionally. They've been hard on relationships, they've been hard on children, they've been hard on isolated seniors, really, I see, so many sectors of society and so many ages and demographics, and I see the toll. So if you're struggling, you're not alone. You're in good company, many wonderful people who are also struggling. And to think about your health holistically, get the vaccine with a mask, but also, as much as possible, do things that are going to keep you grounded and balanced and connected, and get the mental health resources that you can, and stay connected with, family and friends if you can. It's just so important. And I think I'm starting to see some of the consequences the last 2 years manifesting in other ways. It's taking a real toll. So just to name that and hold that, and you're in that place, it's okay. And it's going to change. The world isn't going to be like it was for the last 18 months. It's going to get better. We're going to get better. And we can get better together. So blessings to all of us.
I want to thank everyone for tuning in tonight, and also I want to thank our panelists. Really, again, I don't know, I feel so fortunate for the community that we were able to assemble such a strong group, people who care deeply about the community and have good, accurate information about COVID-19 safety. This discussion will be available on the library's social media 2 weeks from tonight. If you register to attend tonight, you will receive an email with loads of resources, including the ones that you heard here tonight. If you're not registered and you're tuning in via someone else's registration, please feel free to just visit us on our website. On the front page at the bottom, you can just ask us, type in, and just let our staff know that you would like to receive the information from tonight's event. Thank you, everyone. Good night.
Thank you.